Hey, I'm Aisha. You can now watch UCF TV 24 hours a day on Bright House Digital Channel 1.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello and welcome to Public Affairs Today. I'm Alicia Callanan Mandigo. Our purpose is to introduce you to public affairs, which is a surprisingly dynamic field. On the table today, mental health and the Latino population. And joining me today is Dr. Ana Leon from the School of Social Work within UCF's College of Health and Public Affairs. Welcome and thank you for joining me.
Thank you for having me.
You're a person with a lot of titles. You're a professor, you're a licensed social worker, and you're a Latina. And all of those three titles will come into play as we discuss presentations and training methods for social workers and other professionals who may be helping the Latino population work its way through mental health issues. Tell me a little bit about that.
You know, I think that part of what happens is that when professionals are working with this population, that there are some things they have to take into consideration. And of course, you know, people come from cultures, people come from families, and unless we understand what those cultural values are and what the person has experienced, we really are at a disadvantage in understanding the total person. So that's pretty much what the emphasis is to look at the total person within that cultural framework and understand what's going on with that person. And it really allows the helping professional to provide better services that are not a cookie cutter approach, but that are individualized and tailored for that specific population. Now, having said that, one of the things that I have to caution people about is that we can't lump everybody together. And so we have to remember that there are factors beyond culture that one has to take into account. And some of those are things like socioeconomic status, level of acculturation, individual family characteristics. So it looks different from family to family, but there are some general similarities within, let's say, the Latino Hispanic culture.
Now, all immigrant populations have struggled through this issue as they've come to America. I remember when I was working in California, this was a discussion that was being had out there with Asian immigrants who were coming in very strong numbers, like from places like Vietnam, and trying to understand their culture, but then also helping them to understand our culture and how those two things sometimes can come in conflict. The Hispanic population presents an even more unique situation in that as Latinos, we have a shared culture, but then Latinos come from many different countries and each country has its own culture. So when you speak about things like not using a cookie cutter approach and understanding the differences of people's backgrounds, in some respects we're talking about a lot of differences.
We are talking about differences, and that's why it becomes pretty complex, and it's not, you know, again, I think we have to all be very careful about not lumping people into one box and saying, you know, they're all similar and therefore we basically provide the same services. You have to remember that there are differences in terms of language. There are differences in terms of even cultural customs and rituals that people will engage in. There are differences that are based on geographic upbringing. Where were you raised? Were you raised in a rural country versus being raised in a city? And you could both come from the same culture, but then that again is very different. So there are so many different factors to look at. But the one thing that I think really you can see across the cultures are that there are some basic values that the culture has. And whether you're looking at a Mexican population or you're looking at people from South America, you're going to see that those pretty much are similar. Those values that kind of are embraced by the family system and that children are taught and guide how people live, how people relate, how people work. But you're absolutely correct that there are so many differences within even the culture. And I'll give you a good example. If you're from Puerto Rico and you were raised on the island, that's going to be a very different experience than being raised in New York City. You're from the same culture, but you were raised in different places. And if you're an older woman from Puerto Rico versus a young woman from New York City from the same culture, those are going to be generational differences as well. And then you have socioeconomic differences, depending on what the socioeconomic level is. And you can have acculturation differences. So the woman from the island may not be as acculturated as the young woman in New York City who has embraced the American culture and may be slowly moving away from the island traditional culture. So when we speak about cultural values, you have to remember that we're talking in generalities. We're talking about traditional values. But what's really important is that we also remember that those values change as the person becomes acculturated, as the person perhaps begins to marry outside of the culture, and you have a lot of that going on. So you can see some of the differences in how closely does that individual who marries outside of the culture adhere to the traditional values. And you're going to see a whole range of possibilities within one culture. And it's based on acculturation and all the other factors that we've mentioned.
Just being an immigrant can create a lot of stress
Absolutely.
For a family. And that is stress that can then be passed on to the child. Let's create an example here of a family that is experiencing some of those stresses. The child begins to experience some difficulties and is now in need of some assistance from perhaps a social worker or mental health worker. And now we have a problem in that if the family seeks assistance, they might run into trouble because the mental health worker doesn't understand their culture and doesn't know how to work with them in an effective manner.
Right.
If they don't seek assistance, they run into trouble because they have this child that is struggling and not getting the help that it needs. So we almost have a double-edged sword here when we talk about an immigrant population, or specifically the Latino population, and seeking mental health care. Can you talk a bit about that?
Sure, and before I do that, what I want to point out is that we have people, when we talk about people immigrating, we have people from South America that are immigrating, but then you have people from perhaps Puerto Rico and the Dominican Republic that are going back and forth. So you have a lot of reverse migration.
Yes.
And I think what happens is that whenever you have a child acting out and needing mental health services, the parent is put in a situation where, first of all, they have to be able to access those resources. And that's not an easy thing to do. A lot of it will depend on whether the parent is familiar with the systems, whether the parent feels comfortable asking for help. Remember that in many Hispanic Latino families, it's not the norm to go outside of the family and to air your dirty laundry. It's not the norm to ask for help outside of your immediate family plus the extended family. And a lot of it also has to do with the parents feeling that they're going to be blamed for whatever's happening with the child. Now that is similar in other cultures as well. Parents from any culture feel a lot of those things. But I think what's unique about this population is that we have an increasing number of children that if they don't get the help they need, we're going to start to see problems in other areas, education, perhaps in criminal activities and other areas like that. And I think what's also different is that perhaps in other cultures, the parent may be able to move eventually beyond those feelings of I'm going to be blamed and therefore I'm not going to go to the agency, and get help. And with the Hispanic Latino parent, I think that's a little tougher. It takes them a little bit longer to do that. There's also the notion that if I go to this social service worker or helping professional, she's going to label my child crazy, and that has a whole different, connotation in our culture. And in addition to that, this person may not understand, what I'm all about. It may not be a person from the same culture. It may not be a person who is sensitive to the cultural values. And in some agencies, we run into difficulties that have to do with even basic things like language. Can I find, if I go to this agency, can I find somebody that I can communicate with in Spanish, because either I speak no English, or like most human beings, when we're upset and we're emotionally involved in something, we naturally revert back to our native language.
And if you're upset, you just don't articulate well sometimes. Even if you have a good command of the language, you just can't get it out.
Absolutely. And being upset in Spanish is very different, as you know, than being upset in English. I mean, it takes a whole new, meaning, and there's passion, and so you really get a lot of the emotional nuances that you would not normally get, especially if the parent can't communicate in English. So the parent is feeling like they're between a rock and a hard place, that yes, they need the services, but will they be able to find services that are going to be culturally sensitive? Will they get the help they need to make sure that this child gets back on the right track? And what does this all mean? And more importantly, how am I going to be perceived? So there are lots of parents that never seek services because of those reasons. And you have to also remember that many of these parents, because they don't have the level of education and don't understand the value of mental health, really don't think it's important, and so you often hear Hispanic and Latino parents verbalizing, that this will get better because God will will it,
yes.
Or this will get better because He'll outgrow it. Or in some cases, which is probably the worst situation, this will never get better because this is the way this child was born and this is the way God made this child. And because the danger is, because there's such a heavy emphasis on religion and, for the most part, Catholicism, there's a strong adherence to that. So you're going to find that in the culture. Not that every Hispanic is Catholic, but you're going to find a good majority of them are.
Well, that's been my experience as well. You have tried to address this issue by introducing a concept that you call personalismo. The idea that if somebody is going to be of assistance to a Latino family, they have to have a personal, close relationship with them. And that, as an American professional, we need to keep things professional. We can't cross certain lines. And so now we've run into a whole new conflict here. So how have you addressed that?
Well, first, let me just clarify that the whole concept of personalismo is something that has existed for a long time, and it's certainly not a concept that I've developed, but it's a concept that people that have studied the culture have found repeatedly. It's one of the values of this culture, and when you have personalismo, you have an understanding that if I go to you as a helping professional, that you are going to have a warm relationship with me, that it's going to be not a formal relationship, it's going to be more on a personal level, that you're going to take a very active interest in me and really genuinely care about me, almost on a personal level. And so what happens is that the professional, the helping professional who is trained not to cross over those boundaries, really has a difficult time, because it's perceived as violating professional boundaries or violating therapeutic boundaries. So a lot of what has to happen, and what I tell students that are working on becoming social workers or helping professionals, is that you have to reach a middle ground, that you have to be able to keep those boundaries because they are important, but you have to also be able to understand that somehow you have to get in there and almost ease up a little bit on that boundary and be able to relate to that person on a normal, what they consider normal kind of personal basis, and show more warmth than you might with other clients, you know. And so it's a matter of doing both and balancing that out.
Well, can't it in some circumstances go even farther than simply showing more warmth? Because if among Latinos, when you're talking about a personal relationship, we're talking about things like sharing meals.
And food is very important to the culture. So one of the things that non-Latinos have to get comfortable with is that oftentimes when you're working with a family, working with a Latino client individually, that there will be some kind of offering of food. And it could be that if you're visiting them in the home and making a home visit, that they're going to offer you anything from coffee to a full meal, and that you have to be in a position to understand that rejecting that is more offensive from a cultural perspective. And by the same token, you know, you're not going to sit down and eat an entire meal. So it becomes a delicate balance where perhaps, you know, what I often tell students is that if they offer you coffee and something else, and maybe you just accept the coffee and you don't have to drink the whole cup, but you make an effort to kind of join them on a cultural level. Because that's their way of bringing you into their culture, that's their way of developing rapport with you and connecting with you, and it's also their way of giving you something, and that's very important in the culture.
Now, another thing I want to talk about, and this is something that I personally remain resistant to, even though I am a Latina and I was raised within the culture, I'm still resistant to this, and that's the structure of the family hierarchy, where the man is the boss of everything, unless abuelita is in the house, and then sometimes she ends up being the boss, which was the situation in my house growing up.
Right.
And so if a social worker is coming in to assist a family that with, you know, again, we'll go back to a child that is struggling, then it's not just with the mom or just with the dad. There's, you know, the dad has the final say, and then abuelita has to have her opinion thrown in there, and so it just becomes like this group effort, and that's not the kind of thing that American social workers would be accustomed to.
Right. You have a lot of players in that family system. You're absolutely correct. And the other thing is that the beauty of this is, and this is what I tell social workers that we're training, that you don't have to agree with it, and you don't have to feel comfortable on a personal level with it, but you have to appreciate where they're coming from in terms of the importance it has for them. And I'll give you, myself as an example. I don't subscribe to that hierarchy in the family either, but I grew up in that hierarchy, and so I know what that's all about, and I can appreciate it, and I have to use it when I work with clients. But it really becomes an issue of understanding that in a traditional Hispanic Latino family, and again, I want to really emphasize traditional, because as I said, people are moving away from that more and more, especially as you get younger couples and they have to share a lot of responsibilities at home. You're going to see some diluting of that. But in a traditional Hispanic family, what would happen is that to the public, dad is in charge. Mm-hmm. Dad is the person who calls the shots, and there is a certain amount of respect that is given to dad, absolutely. Dad becomes important as the provider, the protector. But then when you look at the family a little closer, you see that the daily activities and almost like the operational kinds of things are carried out by mom, mm-hmm. And if there's a grandmother, then the grandmother, because of the respect for elders, has even more respect in that mom in that particular system. And you find a lot of sharing of responsibility and decision making between those three entities. And oftentimes you will see that women will defer to their husbands for certain decisions, but it's also expected by the husbands that the daily operational kinds of things the women will kind of take care of. And you have some conflict that goes on depending again on the specific family, depending on the generational differences. But the roles are very specific in a traditional family. So, you're not going to find that the husband is going to be making the bed and fixing the bed in the mornings and perhaps engaging in meals. You're going to see the mom and the grandmother involved with that. You're going to see the children become mom's domain, but then you're going to see that discipline issues kind of go over to the dad's domain, and dad is going to be responsible for that on some level. He may not implement the discipline, but he would be involved in the decision making. And all of this, what's important is that, and you know this, that it comes really from one of the values of the culture, which is machismo, where the man rules, and and that's the way traditionally the system has been set up. But it was set up that way for very functional reasons, because again, he was the protector, he was the provider, and we come from a long history of machismo dating back to Spanish influence and other factors. So some of that will still exist, and you'll see that. But again, you're going to see less and less of that in the generations, as they go through.
Now, one thing I want to touch on, and I'm afraid we're going to run out of time, but I do want to touch on this. When I was a teenager, my family was not traditional because my mother married an American, not only an American, but a very liberal American. And so when I got to teenage age, there was a huge amount of conflict between my grandmother and my father, because he wanted me to have American freedoms and she wanted me to be at home, and all of the focus was on me. My two brothers were not the concern here. So it created a lot of stress in our household at that time. We're also seeing that now with adolescent Latinas. They are feeling the stress of cultural conflicts, and as a result, they have the highest suicide risk of any portion of the teenage population. What can we do about that?
A lot of it, again, goes back to the cultural conflicts that exist between parents that may be very grounded in the culture and young Latina adolescents that are now acculturating to the American society. And so it becomes a clash of those values, and it's that clash that gets them into mental health professionals. And I think that a lot of what can be done from a mental health perspective is that, I always advocate for family therapy, for example, and getting those parents to come in, and getting the kids and the parents around the table and talking about the acculturation pressures that the adolescent is feeling, as well as talking about the loss of control that the parents are feeling, because they're feeling a loss of control over their children in this new culture, with a whole new set of rules and expectations and freedoms and liberties that they have that they would not have had they been raised in a traditional Hispanic or Latino culture in their country of origin, perhaps. So I think it becomes a question of opening up communication, helping the parents understand that yes, there is loss of control, but look at the pressures, and helping them both to understand each other's side, what it feels like to be a parent in this culture, coming from a different culture, having the awesome responsibility of having to raise a female, or any child for that matter, and then looking at the adolescent's perspective of my friends are doing it, and how do I fit in? And some of your values and expectations are not only old-fashioned, but they keep me from doing the things that I want to do that my friends are doing. And so a lot of it really, again, goes back to understanding the cultural values and trying to open up communication.
All right, well, thank you. I'm afraid we're out of time. It seems that it went very quickly, but I appreciate you joining me today, and I thought this was a really fascinating conversation.
Thank you.
We can definitely talk more about this. Again, I've been speaking with Dr. Ana Leon from the School of Social Work within UCF's College of Health and Public Affairs, and that's it for now. I'm Alicia Callanan Mandigo. Thanks for watching Public Affairs Today.